Coenzyme Q10 has many different names, some that are scientific and other common names. Coenzyme Q10 is often referred to as ubiquinone or ubiquinol. There is no known established dose for coenzyme Q10. However, a typical dose is around 100 milligrams to 200 milligrams per day. It is recommended that patients take coenzyme Q10 in divided doses for doses that exceed 100 milligrams. Coenzyme Q10 comes in chewable tablets, wafers, liquid syrup, and powder and gel-filled capsules. You can find coenzyme Q10 at local community pharmacies, online, and stores that sell supplements.
The most common uses for coenzyme 10 are congestive heart failure and hypertension. In respect to congestive heart failure, coenzyme 10 has been shown to reduce both mortality and hospitalizations with statistical significance. Hypertension was lowered significantly in 2 small studies as well. The efficacy has only been shown in small studies and is not regulated by the FDA. However, coenzyme 10 is safe to use, and the preliminary data shows it has promise in treating heart conditions effectively.
According to the Natural Medicine Database, there are 2 likely effective indications for taking coenzyme Q10. These include mitochondrial encephalomyopathies and coenzyme Q10 deficiency. It is rare to have a deficiency, but taking it showed to help the symptoms of weakness, fatigue, or seizures. Mitochondrial encephalomyopathies are acquired or genetic mitochondrial dysfunction disorders. The FDA has given orphan drug status to a specific formulation of coenzyme Q10 called UBO gel to aid certain types of the disorder. One possibly effective indication is migraine headaches. Studies have shown that headaches decrease up to 30% when patients took coenzyme Q10. Other possibly effective indications include, but are not limited to, age-related macular degeneration, fibromyalgia, multiple sclerosis, and cocaine dependence.
Coenzyme Q10 is utilized in the body by mitochondria within cells via the electron transport chain during ATP synthesis. Coenzyme Q10 is responsible for shuttling electrons between various complexes. This electron transfer is coupled by the movement of protons across the mitochondrial membrane to drive the synthesis of ATP, which is your cell's main source of energy. Coenzyme Q10 also functions in your body as a lipid-soluble antioxidant and membrane stabilizer. This allows it to protect lipids, proteins, and DNA from degradation. The human body naturally produces coenzyme Q10, and it can also be obtained in small quantities from certain foods, such as red meat and fatty fish. Due to coenzyme Q10's essential bioenergetic effects in the body, deficiencies can cause many negative consequences, such as the common uses for this supplement as stated previously.
Many research has shown the potential benefits of coenzyme Q10. This includes cardiovascular disease, age-related macular degeneration, diabetic neuropathy, Parkinson's disease, and multiple sclerosis. And also, taking coenzyme 10 significantly reduces the duration and frequency of headache.
So, potential risk and adverse effects. In general, the coenzyme Q10 is very well tolerated. In very rare cases, it may cause GI upset, including nausea, vomiting, diarrhea, decreased appetite, heartburn, and general epigastric discomfort. Possible adverse effects as a result of coenzyme Q10 are heart palpitations, UTIs, thrombocytopenia, increased plasma creatine kinase, headache, insomnia, burning sensation, and worsening depression. Again, these are just possible effects. They haven't been studied to a great extent. They were just noted in some patients who are also taking coenzyme Q10. If you are having any of these side effects, and your daily dose is greater than 100 milligrams, try dividing it into 2 to 3 smaller doses. Or if you have any of the more serious adverse effects, please contact your doctor.
There are a few interactions between coenzyme Q10 and prescription drugs to be aware of. Studies regarding simultaneous use of warfarin and coenzyme Q10 showed conflicting results. A 1994 study reported a decrease in patient INR, whereas a more comprehensive 2003 study reported no change in patient INR. Caution is advised in patients taking these medications together. Coenzyme Q10 decreases blood pressure, so use with antihypertensives may result in hypotension. Interactions between anti-cancer drugs and coenzyme Q10 can result in increased coenzyme Q10 levels and provide cancer cells protection against chemotherapeutic drugs and radiation therapy.
Practitioners should be aware that common side effects include nausea, epigastric discomfort, diarrhea, heartburn, and loss of appetite. Rash and flu-like symptoms have been reported, but they aren't common. There has been some research as to what conditions coenzyme Q10 may be beneficial for. These include angina pectoris, congestive heart failure, diabetes, hypertension, migraine prevention, infertility, and Parkinson's disease. As a caution, liver function should be monitored, and those with diabetes should more closely regulate their insulin levels. There has been no research as to the effects of coenzyme Q10 on pregnant women. In addition, there is evidence of interaction with anticoagulation medication.
There are a couple of key points to mention when making recommendations to patients. It would be important to explain what the supplement is and how it affects the body, making sure to explain in everyday terms. This can include mentioning the types of diseases it can help too. Another key point to make would be considering dosing and making sure the patient understood the recommended dose is 100 milligrams taken 2 to 3 times a day. Here, the pharmacist can mention that it might be beneficial to take with food, as it could help with absorption of the medication and decrease negative side effects. Finally, it would be important to mention what those negative side effects are, and when it would be important to talk to their doctor about the side effects they are experiencing, such as those related to abnormal liver enzyme levels.